Imagine if losing weight was as simple as swallowing a pill. Well, now it is. Well, sort of. The Allurion balloon is a game changer when it comes to non-surgical weight loss. It was only approved for use in Australia recently, and to tell us more, we're joined by Felicity Cohen from Weight Loss Solutions Australia, as well as one very happy customer, Kylie Allen. Hello, ladies. Thank you so much for joining us this morning. Felicity, we might start with you. You've actually brought it in with you.
I have. I've got the balloon device here, and this is what it actually looks like before it's inserted into the patient's stomach. It looks like that.
So it's that pill. It begins with that pill. Is that right?
Exactly right. That's the pill that the patient swallows.
OK.
In a procedure, it's what we call a procedureless procedure. So it's non-interventional, non-surgical, and the patient actually has this in a clinic environment. So there's no anaesthetic, there's no endoscopy. It actually really lowers the anxiety from a patient perspective. Just the fact that they don't actually have to set foot in a hospital setting for many people is a real advantage.
So how does that pill then become that balloon?
So during the procedure, it's actually inserted, and then there's a couple of... the radiographer actually takes a couple of x-rays during the procedure. So just to check the position, firstly, and then to fill it. So it's filled via a catheter with 550 mils of fluid, and then this is what it looks like, and it sits inside the patient's stomach.
Wow.
Wow. So can anyone get one? The magic bullet here?
So I guess, you know, this is a treatment for patients who are either overweight, or we're treating patients who are overweight or morbidly obese. And so the critical thing is, you know, when you're looking at this patient population is, first of all, the why. So are there medical concerns that we're needing to treat first and foremost? And there's no one-size-fits-all. There's no such thing as a magic pill. So for us, it's all about assessing, diagnosing and establishing best procedure for each individual patient. So for many patients, this is a really suitable device or intervention. So, for example, someone who might need to lose 10 kilos or more, they might have a body mass index of greater than 27. So for this is absolutely amazing for so many people. And, you know, when we look at the global figures around obesity, the prediction for 2030 is that 51% of Australians are going to be in a category where they're either obese or morbidly obese. So
yeah, something needs to be done, right? Let's bring in Kylie. Kylie, when did you have this procedure, and what was it like? Have you had any side effects?
No, I got my procedure done in December, so I've passed my 4-month time of my balloon. There was no side effects. There was a little bit of discomfort just in fullness when you first start, but other than that, yeah, it was fine. It was great.
Wow. So how much weight have you lost so far? And did you start losing weight straight away? I mean, has your life changed, everything else that you do around it as well?
Yeah, absolutely. I was really grateful that I lost 20 kilos in the 4 months, and it did start, you know, straight away with the help with the dietitian, with the nurse and psychologist. They help you along the way. They teach you, you know, how to eat better and better portion sizing, and, you know, when to eat and how often to eat. So yeah, it was great.
So the balloon makes you feel much fuller for longer. Felicity, how does this device compare, say, then to the gastric sleeve?
So the gastric sleeve is really designed for patients who may have multiple medical comorbid conditions. They might already have things like type 2 diabetes, or be pre-diabetic, or suffering from fertility-related problems, or they may have sleep apnea. You know, we're looking at patients who have multiple medical conditions. We're looking at not only improving them, resolving them, and setting them on a trajectory where they're going to have a much better quality of life, but they're also going to see a multitude of outcomes that are long-term and sustainable. This is also a really incredible device for sustainability and long-term results, but we're looking at different patient cohorts. The sleeve is a surgical procedure. It's done in a hospital environment. This is actually completely non-interventional in its approach, so really, really quite a different device and approach from something like a surgical procedure.
Wow. Yeah, a lot of people will be looking at it and going, that's a great idea. You know, obviously, Kylie's lifestyle has changed an awful lot as well, but what kind of cost would be involved with something like this?
So the cost varies, but for us, one of the critical components is having a multidisciplinary team. So having a team of bariatric health professionals that support, guide, educate, and get patients to a situation where they've formed lifestyle habits that are going to be for the rest of their life. And that comes at a little bit of a cost as well. This technology is so unique and so amazing that definitely it comes at a cost. It also includes smart scales and a smart watch, which allows patients to be accountable and to assess all their outcomes long term. It's about $7,000, $7,700, I think, thereabouts, inclusive of a 12-month unlimited access support program.
And the balloon actually passes through the body, right? It doesn't stay there the whole time.
Exactly right. So at 16 weeks, there's a dissolvable suture, and that breaks down, and the patient naturally passes the device.
Kylie, your balloon has passed through your body. How do you feel? And have you found that your hunger's come back? Has your life changed in any way, or are you on this completely different path?
Yeah, no, it's been amazing. I have so much more energy. I have just completed a 5K run with my daughter, so I was very excited to be able to do something like that with her. That's been a highlight for me. Also, just learning how to eat and portion size. So the hunger hasn't come back because along the way I've learned how to eat correctly and what my body needs. Just a new lease on life, going to the gym, just enjoying having the extra energy and the confidence.
Oh, wow. That's awesome to hear. Would this be something,
Yes.
so it's kind of like a kickstart kind of thing, it's the break a habit for a lot of people. Would this be something that you would maybe get again, or is it a one-off thing?
Would you need a top-up at all, top-up treatment?
It's quite possible that patients can have a secondary device. In fact, the research does show that they get far greater outcomes, especially in a patient who has maybe a little bit extra weight to lose. Once again, I think the most important part of this is making sure that you've got this incredible team of backup support. It's not just the device alone. The device is absolutely incredible, but the team of nurses, the doctors, the dietitians, the psychologists that really work with our patients, they're the ones who make such a difference to getting the results that we're looking for.
Well, Felicity and Kylie, thank you so much for chatting about this today. Certainly something that many people find interesting. We'll pop all the details on our socials. Thanks again.
Thank you for having me.
Thank you.